My military service began May of 1986. I was in Saudi Arabia, Iraq, and Kuwait. I was a truck driver, and I was a light-wheeled and heavy-wheeled vehicle mechanic. I was first diagnosed with MS March 12, 2001, but my symptoms began in the Persian Gulf War in '91. When I came back home and I was in law enforcement, things would happen along the way that, if I ran after a suspect, I would start running sideways instead of straight. Or if I walked, I would have to sometimes sit down or I'd fall.
Julia is an amazing woman. She has so much energy. She has such a passion for life.
She has MS, and definitely MS does not have her. She's just a patient with MS. She's a writer. She works out, she goes to the gym. She has a family, and she has some bladder problems.
Multiple sclerosis very commonly involves the bladder. Up to 90% of patients have a bladder that's affected.
What we find MS can do is it can affect the ability for the urine to be retained in the bladder, so basically the ability of the bladder to hold urine, or the ability of the bladder to get rid of the urine.
I had an urgency, I had to go to the bathroom quickly, suddenly, or I had to go multiple times, or when I went, I figured I'm done, I'm about to leave, and I gotta go again.
So the patients can complain of urinary frequency, urgency, urgent continence, as well as hesitancy, that means difficulty getting the urine to start, and some patients, as their disability increases, may have trouble actually emptying their bladder completely.
So if you're not able to empty your bladder, that means that you're retaining too much urine. And I always tell patients, if you retain too much urine, that can then back up to the kidneys and cause some long-term complications.
It's important that you do see an MS specialist if you have MS.
So how are you doing today, Julia?
Good.
When Julia talked to us about her bladder issues, the first thing she talked about was that she was waking up a lot at night to urinate.
I would get up at night so many times to go to the bathroom. And one time I said, I want to know how many times, because I wouldn't remember. So I remember one time what I did do was, if I had perfume in the bathroom or lotions, every time I went to go to the bathroom, I would put one on the sink. So in the morning when I woke up, I remember this like it's yesterday, there were 8. I said, wow. So then that would ruin my sleep.
So that was having a pretty dramatic impact on her quality of life. So you can imagine if you're getting up 5 or 6 times a night to urinate, if you're already having issues with fatigue from the MS itself, well, sleep deprivation is going to make that all the more worse. I'll often tell patients, I need to refer you to a neurourologist, which is a urologist that specifically specializes in neurogenic bladder, which are the issues we see with bladder in multiple sclerosis.
One of the important things, in my opinion, that is very helpful to me to evaluate a patient's voiding status is to ask them to keep a bladder diary.
Dr. Gahuli asked me to make a notation of things, and it was good because at the same time I forget, and my short-term memory is not as good as my long-term. So then what I would do is I would put it on my phone on the notes section. I would write things down.
It doesn't have to be anything sophisticated, just a piece of paper, day by day, how many times you've gone to the bathroom, how did you feel? Did you feel that you emptied? Did you have an accident before you got to the bathroom? Were you experiencing burning or pain during urination? And just keep track of it.
We start with urodynamic testing, which is testing of the bladder function, so we can find out where is the problem. That's always the starting point for figuring out which medications are going to be effective.
So Dr. Gilhuli at the East Orange VA, she did a urodynamic study, and that showed how my bladder was working or how it was not working. And then she would go ahead and show me on the monitor, there would be a graph with different colors. I mean, it was really easy to understand. She would say, this is what's happening and this is what's not happening. So if you take this medication, this is what it's supposed to do for you. And I was like, okay, let's do it.
So the range of treatments could range from no treatment at all to a variety of medications to relax the bladder, to improve their urgent continence, and to assist emptying, decreasing their hesitancy.
And what Dr. Gahuli decided to do was to start her on a medication that would help her empty her bladder a little bit more effectively to hopefully decrease the number of times she was waking up in the middle of the night to urinate.
The medication was really good with both the frequency and the urgency that I had and the sleep. So it helped everything together. And I thought that was terrific.
There is often bladder issues in MS, so you really need to discuss them with your provider. And there's consequences to letting things go for a long period of time and not bringing them up.
There's something you can can be done about it, that you need to speak to a multiple sclerosis specialist and a neurourologist who has experience with the neurologic bladder.
It's very common for patients to attribute their lack of urinary control or difficulty voiding with a more common condition like a urinary tract infection or an enlarged prostate or just age-related incontinence if that's what they perceive. And they don't always relate it to the multiple sclerosis.
It's often treatable, but if we don't know about it, we can't treat you. We want to help you. We want to give you your life back, but you need to talk to us about it. So let us know when there's an issue. Providers, I would say, make sure to ask very pointed, specific questions with patients. Tease out the bladder issues that are there. That's how we teased out, oh wait, you're waking up that many times every night to urinate. And the details really help us in establishing a good treatment plan for her.
I would say to other veterans and to others who have MS or any type of illness, you know, don't keep it quiet, because just by keeping it quiet, it's kind of stressful. So, you know, you talk about it. It's okay. And the more you talk about it, the easier it becomes.
Julia is a wonderful woman. She is very vivacious, and she has not been stopped by her multiple sclerosis, not in the least.
She's just a real go-getter. She's so encouraging to us, to other patients. She's always just pouring positivity into the air.
My advice to patients with MS and veterans with MS is never give up.